So now, are you comfortable there?
I am very comfortable,
All right,
thank
good.
you.
And you're getting over it.
Yeah.
Mrs. O'Reilly had a procedure done on Wednesday,
Yeah.
2 days ago, because she presented with right lower limb problems. What did you notice was wrong with it? With your right lower?
Well, the week before,
Yes.
I had pains in the calf of the leg.
Mm-hmm.
We were walking up and down the stairs, very bad cramps.
Yeah.
And then Monday night, last Monday,
Monday
a
of
week
this
later,
week.
yes, all there was covered and all that, just like that.
Went kind of black, is it?
Black, yeah,
Yeah.
and the toes went numb. White,
They were white as well.
they were white, pure white.
Totally white.
Yeah.
And did you notice that yourself?
Oh, I did, yeah.
Mhm.
Noticed that. So I went to my GP then on the Tuesday morning.
Tuesday gone by.
Yeah,
Yeah.
Tuesday gone by. And they sent me to the regional.
Yeah.
And they did a lot of tests.
Mhm.
And then they sent me here to the Mercy.
What did the GP make of it?
He didn't actually know.
No.
He didn't know at all. He just sent me.
But he was worried about
But
it.
he was worried. He told me to go straight away.
So the whole thing is going on for a couple of weeks, you think? Is that
Well, you're talking a week and a half.
no
That's
more
all.
than that?
Oh, that's all, yeah.
So let's say back in May, April, were you able to walk?
Oh, I was
Totally
able to
normal.
walk, like, yeah, but I am short of breath anyway.
You're short of breath. So you weren't
Good.
doing long walks anyway?
No, not really, no.
For what time or what distance would you normally walk before the
Oh, for
breakfast
about
might stop
15
you?
minutes.
15 minutes.
That's about it, yeah.
Yeah.
I go up and collect the grandchild.
Slowly.
Oh, it takes my time, yeah.
Would you stop a little during the 15 minutes
I would.
because of the breathlessness?
Because for breath.
So you weren't getting pain there.
No, not at that
Not
time,
at that
no.
time.
No.
So it's relatively recent,
Yeah, yeah.
but on a
very
background
quick.
of not doing an awful lot of walking
Yeah,
before it, is that correct?
right, yeah.
So tell me a bit more about the pain in the calf then. What did it feel like?
Do you know, like, a cramp, you know, you get
Yes.
cramp,
Yeah,
but it was worse than that now.
worse than that.
Yeah, especially coming down the stairs.
Yeah,
I found it worse
interesting.
than going up.
Yeah.
Yeah.
And did it stop you?
Huh?
Did it stop you?
No.
Like, would you have to stop for a break?
Oh, sorry, I thought you would stop going upstairs.
Oh, yeah.
Oh, I would, I'd stop, yeah.
You couldn't
Yeah.
keep going.
Couldn't keep going, no.
And if you tried to keep going, did the pain get worse and
Oh,
worse
it would
and
get
worse?
worse, yeah.
And eventually you
yeah,
couldn't
it would
function?
Weak, very weak.
Yes. Was it
Yeah.
tight? Did it feel tight?
Yeah, very tight.
Yes.
Very tight.
And if you didn't walk, you weren't getting that pain
Oh, no.
initially?
No, no.
So when you were standing around,
Or standing or walking, the stairs was the worst.
the worst. But if you
Yeah.
were just standing in the kitchen, were you all right?
Oh, I was all right,
No
yeah,
problem.
yeah, yeah.
Only when you walked.
But I walked, yeah.
So on Monday, gone by, so 4 days ago, that's when
Yeah.
it went really bad.
Monday night at 8:15 to be exact.
How do you
And that was
remember? How
perfect.
do you remember the time?
I remember taking off my runners.
Yes. And you
And-
checked the time, is it?
Yeah, it was 8:15 because I was going upstairs. I was going to actually going to bed,
And that's when you noticed
and that's when I noticed the colouring.
the discoloration.
Yeah,
So it was dark here,
yeah.
and the toes were
And the toes, they were white and they were all purple as well
Blotchy.
around them. They were all, yeah,
Blotchy.
yeah.
Did you have pain in the toes at that stage?
I did at that time.
Only
at
then?
Monday night, yeah.
Monday night?
Yeah.
But you did not have pain in the toes before that?
No, no,
And
no.
did you have it all that night?
I did actually, yeah, it kept me awake.
Did it
Like
keep
when
you
I was
awake?
dozing, it wasn't a violent pain.
But it did wake you.
It woke me a few times, but I was able to go back. Like,
Just show me with your hand where exactly you felt it.
the pain.
Yeah, the foot pain now, not the
Yeah.
calf. Just from there,
Yeah.
and the toes.
And the toes.
So it wasn't up here,
No,
it was down
out there.
in
Just
the toes,
there
the
now.
forefoot. So typical distal pain. Yeah. How about the feeling of the foot?
Now,
No, then on the Monday night into the Tuesday.
oh, it was kind of dead now.
Dead,
Yeah,
numb.
numb. Yeah,
And that was a new thing as well.
yeah.
And did it feel cold?
It did. It was cold. Yeah.
Did it feel cold to you, or only when you actually touched
Only
it?
when I touched
You
it.
touched it.
Yeah,
It was definitely
Yeah.
cold.
it was ice cold.
How about
Compared
the
to that.
It was different to that one.
Oh, very
Yeah.
different. Yeah.
And how about the movement of the toes? And
I didn't have much movement at all.
it was reduced, was it?
Yeah.
And did you
Very
notice
much
that
so.
as well?
Oh yeah.
Were
I
you
couldn't.
You couldn't move it much.
No.
So were you able to stand on it?
I was, but I'd be kind of limping. You know, I was kind of nervous
So-
of it more than anything.
Did it go from under you, or did you?
No, it never went from
So
under me.
you
No.
weren't able to walk at all then, basically.
No, would I be limping?
Yes,
You know.
but it wasn't working.
Yeah.
How far up did the numbness and the coldness come, do you think?
or only across the.
Just across the front here.
Yeah. Oh, that's
From here up, you weren't too
I was
bad.
fine. Yeah.
So
I was,
that's
normal.
quite clear. How is it now?
it's good now. Yeah. Yeah. It's good.
Back to normal, or not quite yet?
Well, not back to normal, but I say it's going the right direction. And the feeling.
Do you think that the sensation, the feeling, is normal in it now?
There is still a little bit of tingling in it. Yeah.
Yes.
That's the way I can describe it.
Yeah, that's quite
Yeah.
clear. But it's coming
But
out.
that's what I
There's good
mean. Yeah,
movement
it's definitely getting there.
and is the pain gone out of the toes?
Oh, it is.
It is.
Oh, that's completely gone.
Completely. So you've been sleeping the last few nights?
Yeah, yeah.
Good. Yeah, that's good. So
Yeah.
it's on the mend. That leg hasn't bothered you, has it?
Never. No.
Nothing like that.
Nothing like that.
And you stopped smoking years ago, I think you told me.
6 years and 4 months. Yeah.
Good. So Miss Riley had a femoral end arterectomy for a very severely diseased common femoral artery, and that's an open procedure. She also has some occlusion of the superficial femoral, but by opening up the profunda, the perfusion to the lower limb is sufficient, it seems, at this stage anyway. And if you don't mind, I'll just show the dressing.
Okay, doctor.
This is a PICO dressing, which is very useful in groins because it adheres to the skin very nicely. It prevents skin rubbing on skin, and it's a vacuum system which is battery operated. The batteries keep it working for a week, and it can actually deal with quite a lot of exudate, up to 300 mils I think in a week, which is sucked up this way and it evaporates through the dressing. That's not an issue here, it's quite dry. There's no hematoma, the tissues are perfectly soft. There's no inflammation around it, it's not tender. We don't take it off for a week, unless there are symptoms or local signs to suggest infection, but all is well at this stage. So if one did feel through it, one would feel a normal femoral pulse. Distal pulses are not palpable because the perfusion of the lower limb is via collaterals, and the right lower limb is actually still a little dusky. There is a bluish tinge compared to my hand, but yet there's pinkness in it. That was extremely pale on admission, and the fixed discoloration was where the skin was actually becoming necrotic, I suppose. Well, it wasn't necrotic, it was heading that way. So that's now perfused on Tuesday night actually, and on Wednesday morning that was quite fixed, so I wasn't sure if that part of the skin would recover. And the second toe and the third toe, I suppose, are the most severely affected, but again there's quite good capillary refill and perfusion. The dustiness will settle. The veins on the dorsum of the foot are well filled. She hasn't got varicose veins, so that's a reliable indication as well of perfusion. And the temperature, I'm done with my left hand this time, it's quite good actually. There's very slight coolness of the toes. It's actually the same as the other side, so there is no temperature gradient apart from a normal one. And I'll just lift the legs up if that's all right, and I'll take the weight of them for you. And when elevated, we're not very high now, and Miss Riley is still not flat, and you can see now it does become pale when elevated.
Yeah.
So that signifies an increase in perfusion compared to what she had, but it's still an ischemic foot when elevated. So likely to continue to have claudication, in which case a further procedure may be required, but the critical element of it has been dealt with. I think that's it.